coronary arteries or vessels. So for the statins, I put a special note over here. These drugs are contraindicated in patients with liver damage or liver disease. And so why that is the statin drugs are heavily metabolized in the liver. And so if your liver is already not working and then we give you some statins, it's going to cause some serious problems for you. So we do not want to give statins to anybody who has liver damage or liver failure. With aspirin, what sort of precautions do we need to implement? Paul? With aspirin, what precautions do we implement? You fussed about it today. Bleeding. Bleeding precautions. Now, what are bleeding precautions? What do we say? What do we tell our patients? Soft bristled toothbrush. Electric razor for shaving. What do you want to tell them? How do they know if they're actively bleeding?
Bruising.
Bruising. What else? In their stool, black tarry stool, petechiae, little pinpoint bruising on their skin. So you have to remember what those bleeding issues are. Now, nursing diagnosis is going to be related to your tissue perfusion. And remember, if we have a patient with a cabbage or a heart cath, we're trying to get everybody back in, so just hang on a second. Everybody who has somebody's email or somebody's phone number in here, text them back and tell them to go back in on that same link, and I'll let them back in. Okay, I'll try to add them in as we go. So what I was saying before is, if you are doing a cabbage, or if you are looking at if we do a cabbage or we're doing a heart cath, our main goal is to improve perfusion, right? So, if we are improving perfusion, then their pulses, every single wear that you're checking should be good, okay? They should not have a bad pulse anywhere. And if you do, that is a sure sign that something has happened. Either a blood clot has formed in that artery or in that vessel that they used for the heart cath, or that the vessel they used to do the open heart surgery, something has happened and you need to call the doctor. So we want to make sure that we can do that. So you guys who have just joined us back on this thing, if you have anybody's number who was in here before, I think there was like 20 people in here, like Elizabeth Tinch or some of those LPNs, if y'all have their numbers, if you will tell them just to use that same invite link, I'll let them back in. If y'all will get on the phone and tell them that, please.